You can call 211 or visit the website online to find a testing location near you. Most providers offer same-day testing, but you do have to call ahead. The 2 testing sites operated by the Wisconsin National Guard are also an option for testing. And as we also have some good news to share about Milwaukee County Eviction Prevention Program. Eviction filings in Milwaukee County courts have decreased over the past few weeks, thanks in part to the eviction moratorium. This is a great example of what happens when we work upstream. Some of Milwaukee's larger landlords are working directly with the county and our partners to address the concerns and identify resources to keep them in their homes. So far, 4,600 applications for assistance have been received, and $2 million in assistance have been provided through community advocates. All funds for this program are projected to be used up by the end of the year, and our hope is that we can continue these vital programs with additional funding from our state and local partners, but also our federal partners. We have to continue to rely heavily on our federal delegation to bring back funds for us. It's important to note that when we look at all of our applicants, 80% of our applicants for assistance are Black, and 67% of the applicants fall into the extremely low income category. This highlights the importance of the work that we are currently doing here in Milwaukee County to reach our goal of being the healthiest county by achieving racial equity. And I also want to say thank you to everyone who attended our 3 budget town halls over the last few weeks, whether that was in person, at our last function, or online. But we still need your help to balance our budget and close our projected $42.5 million gap. There's still time to submit your ideas through our Balancing Act tool on the Milwaukee County website. And it's your opportunity to weigh in on your priorities for Milwaukee County. It takes about 10 minutes for your voice to be heard. We've had about 450 submissions so far, and we'd like to hear from more Milwaukee County residents. So you can submit your feedback by the end of this week, and your suggestions will be considered from our recommended budget. But the Milwaukee County Board will also be using your feedback as well when they review the budget. With that in mind, I want to say thank you all for being here, and I'm going to hand it over to Mayor Barrett. And also thank you for your leadership as we continue to go through this pandemic.
Well, thank you very much, Mr. County Executive. I want to talk a little bit about evictions and the housing assistance, as well as the Milwaukee Health Department safety plan that's due for businesses. In addition to evictions, we're continuing to watch mortgage delinquency and foreclosures, because we know how crucial home ownership is for all the neighborhoods throughout the entire city of Milwaukee. So we've been very pleased to see that the Federal Home Loan Mortgage Corporation, as well as the Federal National Mortgage Association, the 2 government-backed entities, have been supporting homeowners this spring and summer. They've been helping through forbearance, pausing payments to be collected at a later date, or folding into future payments, and deferral, pushing due payments out to the end of the loan so that no payments are due right now. In addition, these entities have gone beyond their initial support for homeowners and want to work with banks and servicers to stay ahead of foreclosure. We'd like to see other mortgage lenders and servicers do the same thing during this pandemic. Again, it's in no one's best interest to have people losing their homes. And there might be a short-term feeling of gain by the lenders if they put someone into foreclosure, but I think we all recognize that basically nobody wins when there's a foreclosure. So we applaud the federal government for the work it's done, and hope that those private lenders are also looking for ways to work with people so that they can get through this very difficult period. Thus far, we have not seen a local increase in foreclosures, but we're working with Take Root Milwaukee, our local group, to stay ahead of this issue. We know how crucial home ownership is for building wealth across our community. And when we look at the issues of racial equity and fairness, we know that home ownership is a very, very important part of this. And we want to do everything we can to grow and sustain home ownership. And that's one of the issues that we're looking at with the limited resources we have in our budget, how we can have more home ownership, particularly in those neighborhoods where we have historically, or at least recently, not seen a lot of home ownership. So stay tuned on that. With our National Guard testing, Dr. Weston talked about how we've seen a reduction in testing. Actually, yesterday we had one of our better days in the last couple of weeks. We had 686 people at UMOS on the south side. We had 541 people at Custer on the north side. Some of those were people who came to the north side because there were a few challenges on the south side. But those numbers are actually up for yesterday, which is pretty good. But I agree with Dr. Weston that we've continued to see this decline in testing, and we would prefer not to see that. We know that that is something that is still very, very important. We do know with the universities back in that this has become an issue, not just locally. Marquette has taken actions with one of its dormitories, but I thought it was very, very disheartening, and I think very, very sobering to see that among the 7 metropolitan areas around the nation, 7 of the top 20 that have a significant increase in the number of cases, that 7 of those are Wisconsin cities, and that those are cities that are essentially homes for UW campuses. Fortunately, Milwaukee was not one of those 7, but whether it's Madison or Green Bay, whether it was Platteville or Whitewater or Eau Claire or Stevens Point or Eau Claire, that we have seen an increase in the number of UW students that are testing positive. And that's why I think you've seen this dramatic action that's starting to take place. Here we are just 2 weeks into the school year, and we're seeing more campuses already going to the virtual learning, at least for a short period of time. With regard to the Milwaukee Health Department safety plan due for businesses, I want to remind restaurants and bars that under the Milwaukee Health Department's 4.1 order, you are required to submit your COVID safety plan and risk assessment tool by midnight tonight, 11:59 p.m. tonight, in order to continue in-person dining. To access these documents, go to milwaukee.gov/MMFS/safety plan. You can submit your plan and risk assessment tool by email to cehadmin@milwaukee.gov with the subject line COVID safety plan, and then insert your name and your address. Plans will be reviewed as quickly as we can. So again, there's a lot of work that's being done, and there's a lot more work that does need to be done. But I think that the partnership is something that's very, very important. So with that, I'll turn it back over to the moderator.
Thank you, Mayor Barrett. Up next, Dr. Weston.
All right, thank you, Sydney, and welcome. Good afternoon. So first to our numbers, we have had 25,665 confirmed cases of COVID-19 in our community and 421 individuals who've died. We continue to see overall promising data coming out of the county with our percent positive tests stable, right around 5%, and continued relatively low hospitalization numbers. Our case counts have been decreasing over the last 2 months. It's starting to show a little bit of a leveling off, so that'll be a number to watch for any sort of an increase. And also a number of concern, as mentioned, has been our testing levels. So the number of people seeking out testing has been continually declining for about 8 weeks now. And though, as the mayor mentioned, we are seeing some leveling off of that, which is encouraging. We believe that the decrease in testing has been due in part to a number of factors, including simple COVID fatigue, some avoidance of testing with going back to school and returning to in-person work, and COVID really not being necessarily front of mind for many people with everything else that's going on right now. And while that is all certainly understandable, we want individuals to keep their guard up on the need for getting tested. So in particular, anyone who has symptoms of COVID-19, anyone who had close contact with someone who tested positive for COVID-19, or anyone who's referred by public health or healthcare providers should seek out testing. And just as a reminder, you can call 211 for a testing appointment, and that's through the healthcare system and the community health centers, or you can go to a National Guard testing site for immediate testing. Whichever route you go, testing is available regardless of income, insurance, or immigration status. And so while you seek out testing, we are continuing to work on options to keep and expand testing convenience and availability. As we look at broader trends throughout the county, we're seeing lower levels of testing coupled with higher levels of positivity, a bad combination, in our more southern municipalities, as well as the more southern part of the city of Milwaukee. So we're working particularly on expanding testing availability in those regions, in addition to the sites that are currently available there. Next, we've been closely watching the situation, as the mayor started to discuss, at universities around the country, as well as close as Madison, where UW students have seen concerningly high case numbers and positivity rates. Locally, we've begun to see just the early signs of increased disease activities in some of the census tracts near UWM in particular. Tracts that saw single-digit numbers of cases a couple weeks ago are now seeing more than double that in the last week. So while young children, elementary school children, may be less likely to transmit COVID-19, that young adult age group has been shown to be high transmitters, and that's a particular concern for universities and colleges. So while the schools have been diligent in creating plans to mitigate the spread of disease, those plans certainly fall apart when students' night or weekend activities are not physically distanced. So this continues to be a theme that we've brought up many times on these briefings, is that no matter how much a health department, a city, a municipality, or a university legislates and creates policies, it has to be accompanied hand in hand with individuals making smart, safe, and really community-centered decisions. So COVID brings us all together in a sense, in that our individual decisions and actions certainly affect those around us. I'll stop there. Thank you very much. Stay safe, and I will hand it to Commissioner Kowalik.
All right. Good afternoon. Thanks, Dr. Weston. As he noted, we're looking at schools, whether it's K through 12 or colleges and universities. Lots of focus on student behavior outside of academic activities, and just reinforcing that gathering and not using proper precautions is how COVID-19 is spread. So we just want to continue to reinforce those messages to our young adults and our kids, how to prevent the spread of COVID-19. It is a lifestyle change, making sure that we're wearing masks, using proper hygiene, hand washing, using hand sanitizer if we don't have access to sinks, limiting distance 6 feet apart. And then, of course, if anyone is symptomatic, to refrain from being around other people and to get tested. I also want to note the point that the county exec noted about testing, as well as Dr. Weston, to just remind everyone that testing is important to know your status. And whether or not you have symptoms, if you think you may be exposed because perhaps you were in a situation around other people, or you're an essential worker, that you should get tested on a regular basis to make sure that you're good. Again, say if you went to someone's party on Saturday, don't get tested on Monday. Your immune system may not have been able to generate enough material for your test result to show positive. At that point in time, you should wait 4 or 5 days so that your immune system can generate enough response for it to show up in the test. So just want to remind everybody, that's the way it works. Just don't get tested right away, and then you think you're good, and then you develop an immune response a couple of days later, and you're infecting other people, and you may not be aware of your status. So just reminding folks about that again. And as Mayor Barrett noted, today's the day. Today's the 15th of September, and we've been talking about this for a while. We were very mindful in setting this date for a deadline for restaurants and bars to submit COVID safety plans for indoor or outdoor dining. Restaurants, bars can still provide curbside or pickup or delivery, but the in-person dining is what we're looking at, and this is why we're requiring safety plans. Your plan does not need to be approved as of today, because we know a lot of people are going to wait until today to submit them. And as of Friday, we have 300 plans and 140 have been approved. Some of the reasons why some of these plans have not been approved is there may be additional adjustments or consultations that need to happen to finalize the plan. So we do release this information every Friday, what restaurants and bars are approved, and you can get a sense of how many by the number of the placard. Again, the placard is our slime green color and the blue, and it's essentially a COVID safety seal. So look out for that for businesses, as well as the food grading certificate. Now, starting tomorrow, this is what the health department will do for the remaining restaurants and bars. So we'll make sure that we're calling all of those that did not submit a plan. Of course, since they're licensed, we do have the contact information for all of the restaurants and bars. We will educate and give restaurants and bars that have not submitted a plan another 2 weeks. We're not going to issue fines like tomorrow or the 17th. We've been really, really mindful of working with our business owners on this. We know this is overwhelming. We know there's been a lot of moving parts because this strain is new for our world, and we're trying to do our best based off of the information that we have at the time. We will not be able to call all day, you know, so considering the number of restaurants and bars, that some of this will be spread out over a couple of days. If there's no compliance by the 2-week deadline, then we're going to refer those non-compliant businesses to the licensing committee. Again, being licensed is how you operate in your jurisdiction. So this, again, is for City of Milwaukee only. We know that some of the other jurisdictions in our county, they don't have an order, and some of the others in the surrounding area don't have orders. So this does not apply, but this is, again, the state COVID safety plan. And as the mayor noted, the cehadmin@milwaukee.gov email is what you use to submit your plan. All of this information is on our website. We've been very mindful, and we've been listening and making adjustments to our information so that it's more clear, making sure information is translated in Hmong and Spanish so that we can make sure we're reaching more people in our community so everyone knows what the game plan is. And speaking of that, so schools, so far 57 have submitted COVID safety plans. And we do know, of course, Marquette submitted a plan, and I believe they shared theirs. But again, the plan is meant to provide options for still providing instruction in person for those classes that really needed it versus those that can be made available in a hybrid, or not hybrid, but a virtual type of scenario. So we applaud Marquette as well as all of the other colleges and universities and other schools that submitted COVID safety plans. We know it was a lot of work to get that going, but to make sure that you have something to follow and make adjustments along the way based off of whatever is happening. Our medical director and our staff have been wonderful in providing feedback and being very responsive for these situations. So we are grateful that Marquette released this information yesterday to bring awareness, to also show that we're taking action quickly and that we're working together to prevent the spread of COVID-19. My last part is related to the Milwaukee Public School system. So they're responsible for releasing more information about their plan. But just to give you a sense, because I know we've received some questions about what is happening. They're virtual now, and I spoke to Dr. Posley yesterday, and they will be virtual for sure through the middle of October. It depends on what's going on. If we continue to trend downward, which is what you want, that means that the positivity rate will continue to decline, which means that the community spread is continuing to lessen, and that our testing is where it needs to be, that we're testing enough to detect what's happening in our community. So look for an update from them, and I would say maybe later this month or early October about how things will go once they hit that mid-October checkpoint. But again, the City of Milwaukee is making progress. We're moving Milwaukee forward safely and slowly. We don't want to be in a situation where we have to revert back to more severe measures. So we just, again, want to applaud our community, our business owners, and other partners for masking up and taking precautions seriously and distancing. And we will continue to provide information as we receive it. Thank you.
Thank you, Dr. Kowalik. And now we'll hear from Christine Hilmer.
Good afternoon, everybody. I'm Christine Hilmer. I'm President and CEO of the Wisconsin Restaurant Association. We are a statewide trade association representing food service from the Illinois border up to the top of the state, all the way around. We have approximately 1,500 members and 7,000 restaurant locations around the state. So as I start, I just want to share with you some brand new information, some statistics that we got from a recent survey. We surveyed our members August 26th through September 1st, and I have some of those results for you. As you can imagine, the crisis and the closing down of restaurants has been brutally impactful on our operators. Right now, 68% of Wisconsin restaurateurs do not expect their restaurant sales to return to pre-COVID levels within the next 6 months. Even if we were to open up completely, which of course we know we're not, it's going to take a long time to get people feeling confident and safe that eating out is something that they want to do. For a long time, we have been estimating that 30% of restaurants in the state of Wisconsin will go out of business. And unfortunately, that is a conservative estimate. Right now, our members are indicating that within the next 6 months, if they cannot start opening up, and this is statewide, 33% of Wisconsin restaurants will not survive. And if Congress is not able to provide some additional financial and economic relief, 37% of Wisconsin restaurants will not survive in the next 6 months, and those are some pretty staggering statistics. We also know that restaurants have been starting to open up and they're recalling staff. Right now, most restaurants are staffed at about 71% of where they would normally be if they were fully open. And 44% of our members do not expect their staffing levels to return to pre-crisis levels anytime soon. So it not only impacts of course, the restaurant and the restaurant owners, but this is impactful on all of the employees and all of the suppliers that then support these restaurants. And so the ripple effect is pretty severe. So one of the things that we know in Wisconsin is that our weather is not going to stay beautiful. It's a beautiful fall day today. It's been cold in the past week, but we know that this is a trend that's going to be continuing. Restaurants have been able to survive because they have been extending their premises outside. So whether it's through a tent or their patio or using their outdoor spaces as a way to supplement indoors, we know that that is not going to be something that they can continue to do long term. We are certainly advising our members to take a look at what options they can have in order to extend it into the fall later and later as possible, whether it's patio heaters or those tents or putting some sort of an awning up. Any way to do that is going to be really helpful. But we know that eventually the cold weather and the snow are going to be returning, unfortunately, and that's going to shut down those opportunities. So we are encouraging our members to be creative and think of any ways that they possibly can to extend that outdoor dining, because right now that is what is helping most restaurants survive in addition to the carry out and delivery. So some of the recommendations that we are having for our members is we are following a lot of the things that are in the Milwaukee safety plans. And you've heard a number of times, and we need to repeat it, that those safety plans need to be in by midnight tonight. This has been out there for at least a month. We have a lot of resources that are available should there be a restaurant or a bar that needs some assistance with that. We've got a lot of things on our website and we're here to help. I also want to thank the Milwaukee Health Department, particularly Claire Evers. She has been wonderful to work with and really been accommodating to help us navigate this in a way that is smart. It is a way that makes sense for operators, because that's the one thing we do know that restaurants know how to do. They know how to do dine-in safely. They've been doing food safety forever. And so this is an extension of that. And so we know that restaurants can be safe, but we need to go those extra steps and include that 6-foot distancing, the continual training of their employees on proper sanitation, hyper communication to their staff as well as their customers on what to expect and what protocols they have in place, communicate via social media, communicate on their website, during the reservation process, signage at the restaurant, so that people know when they step into your restaurant what they can expect, because it's a two-way street. This is not just on the restaurants, it's on the dining public as well. So if there are protocols in place at a particular operation, the dining public needs to honor that and then follow through with that. And there's little reminders and cues, but that hyper communication is critical. It's also important for customers to visibly see the sanitation protocols that the restaurants have put into place, and that is going to help with that confidence building that it's safe to eat in your operation. And that confidence building is going to be the biggest challenge for us moving forward, and it's critical that restaurants demonstrate everything they're doing in order for customers to feel safe initially when they come to their restaurant, but if they want them to come back. The public health department, I just saw a question come up about how many licensed facilities there are in Milwaukee. I can tell you our membership number, but the public health department can tell you how many are licensed. We have approximately 125 Wisconsin Restaurant Association members in the city of Milwaukee. So in order to retain any sort of capacity limits, these safety plans are critical. And what it means, and it's not that you can go up to your max capacity as your square foot allows. What these safety plans allow you to do is to be open to the largest capacity while taking social distancing into account. And that's not necessarily a 25, a 50% or 75% calculation. It is site specific because some people have the ability to move tables and chairs to add that distance. Others may have booths that they can't move. So it's really site specific. Very quickly, for restaurateurs, we have a lot of resources available, including tips, downloadable files, reopening plans. My staff has decades of experience that they can help you answer some questions to help you finish your safety plans. And for customers, look for the Wisconsin Restaurant Promise. This is something that we developed early on. This is something we've had out since, I believe, May. And it really is helping with the reopening process and things that they can do to physically help people understand what they're doing to keep them safe. Understand that restaurateurs have been working nonstop since this whole crisis started to figure out how you can have an enjoyable meal in their restaurant or carry out or delivery, but do it in a safe way. So they are bending over backwards. And if you have any questions, ask or go to their website. They're happy to tell you to see all the protocols that they have in place because they know they have one shot to get it right to help you feel confident that eating out is safe. And then, you know, the other thing, a lot of people have started to rely on the carry out and delivery. And my ask is that if you want to do delivery, and this is really geared towards the dining out public, is call the restaurant or go to their website to find out the best way to get delivery. There are, and I'm not going to, third-party delivery apps and programs are perfectly fine to use, but not all of them have a direct relationship with that restaurant and may not have all the updated information as far as an updated menu, updated costs, and so on. So contact the restaurant or go to their website to find out how to get their delicious food in a way that they have approved, and it puts the restaurant in the driver's seat, if you would, pun intended, on how you can get their delicious food. So I know we've got a number of questions coming up, so I'm gonna throw it back to you, Sydney.
All right, thank you, Christine. Our first question is from Bill Glauber at the Journal Sentinel. Could Commissioner Kowalik provide more detail on the situation at Marquette? Who made the decision to quarantine the dorm? How many cases were there? Were they all symptomatic? And does the school need to bulk up testing beyond the dorm?
So Marquette will be issuing some additional information, and we've been in consultation with them about that to answer some of those more specific questions. So I will defer to Marquette's PIO for that.
Thank you. Our next question comes from Sari Lesk at the Milwaukee Business Journal. We addressed how many licensed restaurants does Milwaukee have? How many people responded to the Wisconsin Restaurant Association survey for Christine? And then there is one additional question about the Marquette quarantine for Commissioner Kowalik. Christine, will you go first?
Yes, so this was a national survey that Wisconsin restaurants had participated in. I don't have the number, but it's a pretty decent number of responses, but I don't have that number off the top of my head. We just got the results this morning. And so this hasn't even been released to the public quite yet, but I wanted to share some of the statistics that we discovered that makes it, that it's even worse than we thought.
The second question is for Commissioner Kowalik, and Marquette quarantined just the one residence hall as opposed to other schools which have moved the whole campus virtual. Do you have any comment on why?
So our medical team has been in conversation with their COVID coordinator, and a decision was made based off of the current situation. So that's being monitored closely, and we will continue to be in close contact with them about their situation. So, but we did advise them that they needed to quarantine that dorm.
Thank you. Our next question is from Mark Stevens at CBS 58. This one is for Dr. Weston. Dr. Weston, given the decrease in testing, are health officers across the county able to see an accurate picture of the spread of the virus?
So I don't want to speak for the health officers. I'd let them answer for themselves. But I would say overall, as a county, we're still having a pretty good understanding through our percent positivity of what the burden of disease is and what the spread of the virus is. The more testing we have, obviously, the better understanding we have and the broader population we can evaluate. But we're still within our kind of yellow zone, which is that 2,000 to 4,000 tests per day. Certainly, if we cross below 2,000 and hit that red zone of concern, it's going to be harder to understand what's going on in the community, and the presumption would be that we're missing a lot of cases of COVID as well. I'd say right now, even in the yellow zone, we're certainly missing a lot of cases of COVID, and we see that in those regions I talked about where there's high positivity but relatively low testing rates. Suggests there's a lot of people that we may be missing.
Thank you, Dr. Weston. Our next question is from Mary Jo Ola at TMJ4. This is for Commissioner Kowalik. Could you please clarify, are the safety plans due tonight for all restaurants to continue indoor-outdoor dining at all, or are they for restaurants who want to continue indoor dining without capacity limits? The previous release and health order refer to capacity limits.
Yeah, no, this is period. So dining regardless of limits. And there's some that did not submit because they only want to do carry out or curbside. But whenever they do decide to move into dining, then they have to submit a plan. So we are keeping track of that. I don't have the number of those offhand, but I did see a question about how many restaurants and bars are licensed in the city of Milwaukee, and it's 1721.
Thank you very much. Are there any other questions? I'm not seeing any others in chat. All right. Thank you for joining us today. We'll be back again on Thursday. Thanks, everyone.
Thanks, everyone.
Bye. Thank you.